The Heart Ball is the signature event for the American Heart Association in southeastern New England to raise money to benefit actually all the people in Rhode Island through education programs, research, and outreach to communities.
This year's Heart Ball is to protect children and to help them stay healthy, heart healthy, as they get into adulthood. There's a big piece of prevention that's very important here. You know, everybody knows about more obesity, more risk for children. You know, this may be the generation that doesn't live as long as the current generation. So we need to do things from a preventive point of view early on to encourage better habits to keep people healthy from a heart point of view.
Well, Mitchell was diagnosed with a kidney disorder when he was 4 years old. And as a result of that, he has hypertension or high blood pressure. So he takes hypertensive medication or high blood pressure medication twice a day to manage that. He's on a low salt diet and exercises. And through that we're able to manage his blood pressure.
I can still play sports, and I picked up guitar I think 7 years ago when I was 5.
Given Mitchell's condition, it's very important to us that the causes of the American Heart Association are near and dear to our hearts and to our family. The education and research programs that the American Heart Association does are vital to improving the health of the lives of everybody, but our children in particular.
Research is key because there is so much, although there have been significant advances made in the diagnosis and treatment of heart disease over the past 20 years. All these advances raise new questions, and we still have very far to go. Without research, we're not going to improve our care. We're not going to reduce this significant rate of death from heart disease in Rhode Island. There's an enormous amount of research going on at Brown and other academic institutions in Rhode Island, as well as at the Lifespan hospitals. This research spans the whole spectrum from molecular, basic research, to clinical research directly involving patients, to population-based research involving the entire population of the state. The Heart Ball helps raise a significant amount of the funds that go towards supporting American Heart Association funded research.
I'm the chair of the auction committee for the Rhode Island Association, Heart Association. And I've been doing this for 2 years, and what I do is I help raise money for the Heart Ball, which is June 2nd. Last year I raised about $40,000, and the goal this year is $75,000. Well, at the age of 42, my father died of a massive heart attack, which kind of set our family into a tailspin, and my mother's also had a stroke, so there's a history of heart disease in my family, and I thought this is kind of close to home, so I'd like to do something to contribute.
The dollars are used directly to benefit the citizens of the state, and it's one of the great things of the organization, whether it be the over $1 million that comes into the state for cardiac research programs that are done throughout Brown-affiliated hospitals and at other institutions, or through placing automated external defibrillators in different locations in the community so that when you end up having a cardiac arrest, there happens to be a defibrillator there that saves your life. And through the education programs, early warning signs, and things like that reach out to the community, to everyone, to understand better what the signs and symptoms are of heart disease and stroke.
Almost half of children are either obese or overweight. In Rhode Island, more than, I think it's 57% of Rhode Island adults are either obese or overweight. And those are very scary trends. That's getting worse each year. We need to fund organizations and causes like the American Heart Association to reverse that trend. If we don't reverse it, we could see a generation of children who live shorter lives than their parents, and that's a pretty scary outlook.